It turns out a lot of you guys have never seen a stage 4 pressure ulcer, and so I thought I could share a couple of images and we could talk about it for educational purposes only. This is your trigger warning. If you're sensitive to sensitive images, don't look at these. These are extreme. This is a pressure injury on a patient's coccyx. We stage pressure injuries on a scale of stage 1 to stage 4, stage 1 being the least severe, stage 4 being very severe. And we stage these based off how many layers of the skin the pressure injury goes through. Stage 1 is just the epidermis, stage 2 goes to the dermis, stage 3 goes to the hypodermis, and stage 4 goes all the way down to the muscle, and sometimes you can even see the patient's bone. Here's another one. This black tissue here usually indicates that that tissue is dead and that tissue needs to come off. This one is really bad, so that's all dead tissue right there. Patients get these by sitting in one position for too long, having too much pressure on that spot. It can be worsened by things like friction, shearing, moisture. A lot of these patients that are getting these pressure injuries are in one position for too long, over long periods of time, and this pressure on the skin interrupts the blood flow to the skin, and therefore it begins to die. The coccyx is a really common spot for pressure injuries. It's also right near the patient's rectum, so if a patient's incontinent, high risk for getting stool in this and getting infected. This is a pressure injury on a heel. Pressure injuries can happen anywhere, but high risk for happening on bony prominences or if you have like a medical device. Also can be pretty tricky to heal, especially if you have poor nutrition, if you're diabetic, have a lot of comorbidities, then your body is going to have a hard time healing these types of wounds. This one demonstrates tunneling. You can see how these little Q-tips here are going underneath the skin because the wound has tunneled under the patient's skin. A lot of these times, these wounds have to get surgically debrided and washed out, and then they have very specific wound care instructions to help them heal and prevent them from getting infected. Pressure injuries can be healed, but they take a long time, and typically the patients that are having these are not in an ideal state of health, and it makes it very difficult to fully treat this. Pressure injuries can also be preventable by turning patients frequently, identifying any pressure points and protecting them, avoiding medical devices that are putting pressure onto the patient's skin. A lot of these patients tend to be incontinent, not all of them, but making sure that they are clean and dry, and then also helping these patients optimize their nutrition because that is huge with wound healing. So yeah, that's a little bit more on pressure injuries. Very sad when these happen to patients. We always do our best to try and prevent them and take good care of them, but yeah, it's tricky.